Time for our nursing tip of the week. And in this week's tip, we are talking about level of consciousness. Defining level of consciousness can be a little bit confusing, especially with these bottom three here: obtunded, stuporous, and comatose. So I thought we could talk about kind of what all of these are, as well as some things that I see as an ICU nurse to differentiate between these bottom three. So the first one's alert. Alert is you and I right now. We are awake. We're able to sustain our consciousness. We're able to have a conversation. Not to say that alert patients always have conversations, but they are aware of their environment. These are patients with their eyes open. They're able to look around. Maybe they're having conversations. Maybe they're able to vocalize. Maybe they're just taking in information, but they are participating in their environment. The next is drowsy or lethargic. This is a patient that is sleepy but can wake up. So think about you at the end of a hard day. You're falling asleep before bed. You're drowsy. These are typically the patients that you walk in the room and they are always sleeping every single time, but the second you make a little noise or maybe touch their arm, they are able to wake up. When we get to obtunded, this is kind of the first level of consciousness where a patient is requiring more stimuli in order to awaken. They have further reduced alertness along with decreased responsiveness and decreased interest in their environment. This is the patient that you're trying to wake up and they're not quite drowsy because in order to keep them awake, you're constantly having to stimulate them. Obtunded is where I start to get a little concerned about where is our level of consciousness going, especially if this patient is not on any sedation or not intubated. For stuporous, these are patients that are generally not responsive except to vigorous stimuli, meaning like you are sternal rubbing them, you are squeezing their shoulder, you're pinching them, you're shouting their name, and they are maybe minimally responding in the sense that maybe they move a little bit, but again, not much alertness. These patients are not interacting with their environment at all. And when you stop doing the vigorous stimulation, they are out for the count. Hopefully, if you have a stuporous patient, they're intubated. Comatose is a patient that's not arousable to any physical or any verbal stimuli. You can shout their name, you can apply painful stimuli, push on their nails, maybe pinch their arm, squeeze their shoulder, sternal rub them, suction them, stimulate a cough or gag reflex, and they are not giving you any sign that they are arousable. Comatose patients are either heavily sedated, meaning we are purposely making them comatose, or they have very poor neurological status that is making them comatose. Think patients that are brain dead or severe brain injuries. I see a lot of people confuse stuporous and comatose. In order to be comatose, you cannot respond to any sort of stimuli. Stuporous, you're still responding to stimuli, but it is vigorous, it's constant. Obtunded, yes, you do need stimuli to arouse, but not as much as stuporous. That's your tip of the week. Let me know if you have any questions.